We know the importance of increasing physical activity, but let's discuss some practical approaches about how healthcare providers and patients can increase physical activity. So Bruce, we talked about patient engagement, but when's the right opportunity to engage patients?
Well, the window of opportunity is when the patient's coming into the office. It's our greatest chance right there because the patient's concerned enough to be in front of you and you have a chance to start the discussion. So that's always the best time to begin.
So one way to increase physical activity, as we talked about, is to get people to exercise. What is pulmonary rehabilitation? What's the role of pulmonary rehabilitation? And it should be something we should offer to every patient or select patients for?
Well, that's a big topic, Barry. I mean, pulmonary rehabilitation is a multimodal therapy with many healthcare professionals collaborating to work with a patient to help them increase their exercise tolerance, their level of activity, their quality of life, their depression, anxiety characteristics. And it's actually been shown to be remarkably effective. It actually is very effective in doing things like improving exercise tolerance, reducing dyspnea, improving quality of life. It actually does this better than almost any other intervention we have for the COPD patient. And the cornerstone of pulmonary rehabilitation is exercise training, exercise therapy, exercising on a bike or a treadmill or walking exercise. These are all important parts of it. And we have rehabilitation therapists that guide patients through this. Now, you might ask whether this intervention is universally successful in improving physical activity. And the answer is sort of, not universally, but there is a literature, studies, that have tried to see whether rehabilitation improves the level of everyday activity. In many cases successful, in some cases they can't show the benefit. And I think we have to learn to fine-tune our rehabilitation programs so we can get more consistent results out of them.
I think there's other aspects of the training program that we don't usually think about when we start to do training to improve patients' physical activity and achieve their goals. And one is, okay, so the pulmonary rehab program meets twice a week. So here in the pulmonary rehab program, the therapists are great at motivating the patient to do the activity or exercise in that particular session, but they forget about the rest of the week. I mean, twice a week is not going to be all that beneficial improving patients' physical activity. You need to do it more often than that. And I think we need to engage the patients not just during visits to healthcare providers, whether it's rehab or visits with physicians. We need to motivate them on a more broad scale in their daily lives. Bruce, any ways you think about that might help with engaging them on a more daily basis?
Well, yes, and the patient who's seen the rehab specialist or therapist, hopefully that therapist is also having a discussion with the patient about what can you do at home between these sessions. Because we know there's a lot they can do. I mean, housework sometimes involves a lot of physical activity. Making sure you go up and down stairs. Well, maybe you're not going to go up and down stairs 10 times a day, but how about making a point of twice a day go up the stairs so you find a reason or to go down the stairs to the basement. Another example, walking is a great one. And again, once you've assured that you know the patient's safe, having them walk, but start with small amounts. The great thing about walking is you can keep building on that. Look, I'm going to walk to the end of the block and back. I'm going to walk around the block once. Oh, I'm going to walk around the block 2 times. They can slowly build themselves up.
In the absence of having the availability of a pulmonary rehabilitation program, then individual practitioners can help their patients by giving them some ideas about what they want to do to achieve their goals and improving their exercise or performing some kind of exercise.
Safety is primary. You must make sure that it's safe for the patient to exercise. But we now have a few studies in the last couple of years that show that providing patients with simple activity monitors can improve levels of activity if introduced in the proper way. Giving people feedback on what they're doing, giving them targets on improving their activity, having helplines like the COPD Foundation, for instance, and others, can help them improve their level of activity.
I would add one point, and that is that if you're encouraging your patient to walk, to use an exercise machine, having a partner really helps. Now, it could be your spouse, it could be an adult child, it could be a friend. So if a person says, I'm going to wear that pedometer, and I want to try walking a little bit more and a little bit more, having a partner to walk with, that's introducing the social part of this that encourages it. It also is a good way to protect for safety, too, that someone else can be checking in with the patient to make sure they haven't overexerted.
I'd like to thank my co-discussants today. This was very helpful, I think, for me, and I enjoyed hearing your thoughts, and I hope our audience felt the same way.